Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Padma Shri C.R. Chandrasekhar, who has been a professor, medical superintendent, and done a yeoman service in Neurocenter, that is NIMHANS in Bangalore. He has treated and counseled thousands of people and made their life better. And today he is going to teach about how many methods of treatment are there, how we can overcome the depression in the patient. So welcome to the talk, and please go ahead and tell us, our viewers, how this depression can be treated.
Okay. So all of you have learnt about or heard about or listened to depression. Do you remember that I told last time 20 to 30% of people are suffering from depression. So now there are various types of treatment for depression. One is medicine. In severe depression or in psychotic depression or where there is suicidal risk. Person say, I want to rise, sir. I don't want to rise, sir. I'm fed up. I'm frustrated, sir. So when depression is severe, now we have more than 15 drugs, 15 medicines, which improve the level of dopamine, serotonin in the brain, and also other wellness hormones like endorphins and oxytocin.
Oh.
So I've given a list of drugs, 5 drugs, the most common drugs used in psychiatry. One is escitalopram, sertraline, venlafaxine, mirtazapine, and tricyclic compounds.
Okay.
So don't worry about the name of these medicines. Please remember all these drugs, escitalopram, sertraline, venlafaxine, mirtazapine, tricyclics, increase the level of dopamine in the nerve cells of the brain. When you swallow this tablet, in 5 days or 6 days or at the end of 10 days, they act on the brain, they go to stimulate the nerve cells and see that the serotonin level, dopamine level increases. When
They are
dopamine
not
increases,
sedatives, they are not tranquilizer, they are
yeah,
not
they're not
sleeping
sleeping
pills.
tablets,
Yeah.
they're not sedatives, they don't cause any other damage. Please believe in me. And whenever your doctor prescribes one of these drugs, take these drugs, telling that they are very safe and they decrease my depression and make me happy.
Okay.
So they may take about 20 days to act. Don't expect
Okay.
today I take tablet, tomorrow I should be free from depression. It won't
Yeah.
occur like painkiller. We take a painkiller, within half an hour pain gets relieved.
Goes off.
So it takes about 10 to 20 days to act and period 2 to 6 months.
Okay.
So many people come and I prescribe for 1 month, they go back, they improve and they stop. No, sir, I improved, sir, I
That
stopped.
should not happen. Okay.
ಅದು
Okay.
ಮಾಡಬಾರ್ದು. So please don't do that. And period of treatment, doctor decides. In some people,
Okay.
we may stop at the end of 2 months. In some people, we may stop at the end of 6 months. In some people, we may continue for another 1 year or so.
Okay. Okay.
Then what are the other treatment methods? One is counseling.
Okay.
Counseling is also known as talking treatment.
Okay.
The psychiatrist or the psychologist or even a counselor will talk to the person. Come on, tell me how much you are depressed and why do you think you are depressed? What are your problems? What are your stress factors? Who irritates you more? Or whom do you think is the cause of your depression or anxiety? So we have to talk to the person and change his negative thoughts. People, when depression, they always entertain negative thoughts. Oh, I will not improve, sir. Life is very boring, sir. There is no meaning in living. Let me die. Or my wife is very bad. She is the worst woman in the world. Or he is the worst husband in the world. Or my boss is the he is like Ravanasura, sir. He always criticizes me in front of others. He hasn't given me promotion last 1 year, sir. And he won't give me if I continue in the same job, I resign the job, sir. So this type of negative thoughts has to be changed to positive thinking.
Positive attitude.
Won't talk to your boss and impress that you are a good worker, or talk to your wife, or bring your wife. Let us do joint counseling, and we request her to give her story about you. You may give your story about your husband, about your wife, or your parents, or your classmates. So here in CBT, it's a very effective treatment. We try to
Okay.
change the negative thinking of the person to a positive one.
Positive attitude.
Yes,
Okay.
tomorrow will be a good day for you. You are going to fulfill your desires. You might have failed in the examination. Next time you are going to pass.
Pass.
Or this time, three attempts you made to get a job, you didn't
Okay.
succeed. Fourth attempt, you will succeed. So
Okay.
this type of changing the negative thinking to positive thinking is very, very necessary
Important.
because positive thoughts will increase the dopamine level. Or
Okay.
increased dopamine level will lead to positive thinking and
Okay.
interpersonal therapy.
Okay.
Because many people who are depressed, they have interpersonal problems in the family, interpersonal problems in the work situation, interpersonal problems in the college or educational area, or in the society. I don't like my neighbors, sir. Bangalore is very bad, sir. Nobody bothers about anybody. Everybody is very selfish, sir. So this type of statements are made, and they always pick up a quarrel and they blame others. I don't
Okay.
know to call, sir, but my wife starts the calling business. So interpersonal relationship, how to improve relationship. Give more, take less.
Okay.
Or how to talk. Because words have the magical touch. Words,
Yes.
good words, kind words,
Yes.
loving way of even if you want to criticize, know how to criticize a person without hurting him. You want to
Okay.
comment on your younger brother who is not listening to you, the way you talk will improve the relationship and also will change his attitude towards you.
Okay.
Then coping skills, how to cope with problems, how to cope
Okay.
with financial difficulties, how to cope with any frustration. Yeah, or many people think about their past life, childhood days, adolescent period, or marriage, initial period of marriage. A woman may come, sir, I was tortured by my in-laws. My husband always listened to my in-law. He won't listen to me. I remember this and I feel depressed. So, how to cope with such ill treatment, harassment, or other painful experiences because of others' attitude or your own mistakes done, wrong decisions taken, or
Yes.
how to make your life much more meaningful, much more beneficial in future. So, decision making, problem solving, communication skills, introspection, understand your own assets, your strength, assess your own weakness, plan according to your resources, your 50,000 rupees income per month, but you are spending there a lot, taking loans. So how to cope with the situation or cope with a job? Because now many people complain that their job is very, very taxing. 12 hours, 13 hours,
Okay.
14 hours,
Okay.
no time limits, sir. The boss thinks that we are machines like computers.
Okay.
So coping skills have to be taught to the person to manage depression arising out of any difficult
Okay.
situation. Then
Okay.
ECT and RTMS are the treatments where brain is stimulated using an electric current or
Okay.
using transcranial magnetic stimulation. They're very
Okay.
safe. Don't
Okay.
get afraid of ECT, electroconvulsive. Oh, they will give shock treatment, sir. It will cause brain damage, sir. I may die on the table, sir. So this type of fears, because in
Should not
movies
be
they
there.
show how Amitabh Bachchan gets CCT and starts shivering and shaking his limbs, and then the next 3 days he is a zombie. So earlier, direct ECT was given. Now we use what we call modified ECT. Give anesthesia.
Okay.
All the anesthetists, he will make the person to
Hmm.
go into a state wherein doesn't realize what's happening, then give ECT, small amount of current, 100 units, 100 volts of current is passed only for 15 to 20 seconds, and within half an hour it recovers. And
Okay.
it's like a magic. ECT works
Okay.
like a magic.
Yes.
2 ECT, 3 ECT, depression gets removed. So doctors decide, first we decide medicines. Later, if the
Okay.
medicine is not working, or if suicide risk is very high, then we choose ECT or RTMS.
Okay.
RTMS is a magnetic stimulation. Only magnetic waves enter the brain and produce more dopamine and serotonin in the brain. Then yoga
Okay.
meditation, now all over the world, people are behind yoga and meditation.
Yes,
It's a
yes,
gold system of India. It's a big
yes, sir.
contribution of India
To
towards
the
the
whole
health
world.
of the world. And more than 180 countries, they celebrated Yoga Day on 21st
Yes.
this month, June. So, yoga and meditation.
Hmm.
Again, the chant Omkar or do
Hmm.
meditation any kind, because each meditation center teaches certain particular way of doing meditation. Any
Yes, in
meditation
the
is
West,
okay.
this mantra meditation or MM has become very popular
Okay.
because any person who is not believer or not believing in God also can just keep on chanting that. And they
Yeah.
have seen that endorphin and neuropeptides are released, which are feel-good hormones. So naturally they feel better, and then depression will come down with the
Yeah.
feel-good
Yeah.
hormones. Yes, sir.
So
Very
many
nice.
times, in WhatsApp, you get a certain message, do this meditation is the best. So there's no best or not better meditation, because go to a good guru, good
Hmm.
teaching center, and learn meditation in a particular way. And then yoga also, don't
Hmm.
sit in front of TV and move your limbs as
Okay.
the yoga teacher tells you, because it has been
Okay.
done through a guru,
Hmm.
not online but offline. Because
Okay.
no, many online yoga
Online
meditation
also is taught now. Okay, sir.